How you doing, everyone? Welcome to anatomy tutorial number 5. Today we're going to start introducing some of the muscles in the body. So this tutorial obviously builds on the information that has been presented in anatomy tutorial 1, 2, 3 and 4. So please make sure that you've covered those tutorials before you progress on to deal with the content that we have here. Okay, before we start, there's a couple of basics about muscles that we want to cover. First of all, a muscle has two ends that attach onto bones. The muscle's origin and the muscle's insertion. The origin refers to the proximal attachment at the end of the muscle that is generally closest to the torso. For example, in the image that you can see on the screen there, the bicep muscle is highlighted in yellow, and the bicep muscle's origin is located up in the shoulder. It starts up in the shoulder. That is the proximal attachment, the closest to the torso or the midline of the body of that muscle. At the other end of the muscle, we have the insertion. So the muscle's insertion refers to the distal attachment, the end of the muscle which is generally furthest away from the torso of the body. For example, the bicep insertion occurs at the elbow. When a muscle contracts, the insertion will generally move towards the origin. So if we look at our bicep there as an example, I'm going to hold my arm up to the side here. My bicep is the muscle here. As my bicep muscle contracts and shortens, the insertion is pulled towards the origin, and that creates movement at the joints. So the origin is generally at a fixed point, and the belly of the muscle, or the muscle itself, will cross over either one or more joints, and when that muscle contracts, movement occurs as the insertion of the muscle is pulled towards the origin of the muscle. Where the origin and the insertion of the muscle attach onto the bone, we've got a specialized type of connective tissue called a tendon. A tendon is a tough cord of fibrous tissue that connects muscle to bone. Muscles are attached to the bone, to their origin insertion, by the tendons. So again, we'll see that as we take a deeper dive into our anatomy. But a tendon is the type of material that attaches a muscle to a bone. So the origin and the insertion of a muscle are where the tendons attach that muscle to the bone. We've also got ligaments in our body. They are similar to tendons in that they are both connective tissue that join structures together. However, tendons connect muscle to bone, as we've said a couple of times. Ligaments connect bone to bone. Tendons generally tend to be a little bit less elastic than ligaments. If you think of if your tendons were elastic, like an elastic band, as your muscle contracted, the tendon would stretch before movement occurred. So you want your tendons to be relatively stiff in order for movement to occur, and your ligaments tend to be a little bit more elastic, so they are connecting bone to bone, but they have a little bit more stretch in them than your tendons generally do. So today I said we're going to look at the muscles of the shoulder and upper arm. So we're going to focus on the muscles that we see here in this first group here. We're going to look at the deltoids, the pectoralis muscle, and two muscles of the elbow, the biceps and the brachialis, and we'll also just show the serratus anterior. We'll move on then in subsequent lectures to look at the posterior muscles of the shoulder girdle and the muscles at the back of the upper arm, the triceps. So I'm going to switch screens here, and there we go. Sorry, my skeleton had disappeared for a second. Switch screens and go to our skeleton here. So we're going to use this guy to illustrate and bring some of this anatomy to life. If I can add in lots of different things to him. So we're looking at the skeletal system there. If I wanted to look at the arteries and veins that are in the human body, we can add them in. We can look. So what we're doing there is adding in the veins, and we can add in the arteries and see all that in great detail if we wanted. What we're primarily interested in, though, is looking at the muscles that are going to be involved in movement. So with the muscular system, if you remember from one of the previous lectures, we said that many of the muscles are deep. They lie close to the center of the body, and then there are other muscles that are superficial, that are layered closer and closer to the surface of the body. So as I start to add in muscles here, we're initially looking at the muscles that are deep, and then there are more superficial muscles layered in on top of that, until we finish off with the complete muscular system superimposed on top of our body there. So as I said, we're going to first of all start by looking at the muscles of the shoulder girdle. So the shoulder girdle, if you remember, is part of the appendicular skeleton. It joins the arm. It's where the arm is joined onto the axial skeleton. So your shoulder girdle is made up of your clavicle, your collarbone, your scapula, your shoulder blade, and your humerus. So there we have the shoulder girdle highlighted on one side there, and obviously we've got the same replicated on the other side. So we're looking at the muscles that are located on and around the shoulder girdle and result in movement at this joint. So let's layer them back up, because the muscles we want to talk about initially are pretty superficial. So there we go, we've got all the muscles laid on top, and what we are looking at first are our deltoids. Our deltoids are a group of individual muscles there. There's 3 parts to it that form the deltoid muscle group, highlighted in yellow there. In the deltoids, we've got 3 different heads of the deltoid. So sorry if I exit out there. So we've got this part here, which is known as the anterior portion of the deltoid because it is located to the front. In the back, we have got the posterior portion of the deltoid because it's located to the back, and we've got the medial portion of the deltoid, which is in the middle. Each one of these muscles, that's zoomed in pretty close there, has an origin and an insertion. So the origin in this case is slightly different for each part or each head of the deltoid muscle, but you can see there that the origin stretches from the clavicle, from your collarbone, around your shoulder blade and around the back of the shoulder blade here. This bony protuberance, this bony part of the shoulder blade here is called the spine of the scapula. So it's a site or point of attachment for for lots of muscles. In this case, our deltoid muscles. And what we can see is that even though we've got a kind of a fairly large area for the origin up there, the deltoid muscles all converge on one spot here, and they insert onto the humerus. So insert onto the upper arm here, and specifically that bony part where they insert onto it is called the deltoid tuberosity. So there's a part where a little lump on the deltoid where the deltoid on the humerus where the deltoid muscle attaches. So if we go back, you can see there's the deltoid tuberosity there. So if you look, you can see where that shoulder muscle, the deltoid muscle, rounds out and comes in, and in someone who's super lean with low levels of body fat, you can see that kind of indentation in their arm there, and that's where the shoulder muscle inserts onto it. So this anterior portion, the anterior part of the deltoid, it originates on the clavicle, inserts onto the humerus, and its main action is to flex the shoulder joint. So flexion of the shoulder joint is bringing your arm up like that, decreasing the angle at the shoulder. And an example of that would be a frontal raise. So a frontal raise exercise in the gym would target the anterior head of your deltoids. The medial head of your deltoid, highlighted here in yellow, lies the middle. It originates on the scapula, on the spine of the scapula. It also inserts onto the humerus at the deltoid tuberosity, as we've pointed out, and its main function is abduction of the arm, so moving the arm away from the midline of the body. An example of an exercise would be a lateral raise with a dumbbell. So as opposed to a frontal raise, this time we're talking about a lateral raise. Then it should be no surprise that with the posterior part, the posterior head of the deltoid also, posterior head of the deltoid there originates on the scapula, on the spine of the scapula again. It inserts onto the humerus, onto the upper arm at the deltoid tuberosity, and its function, main function, is extension of the arm. So if you use your anterior deltoid to flex your arm as you bring your arm back down, one of the muscles involved in that movement is going to be the posterior head of your deltoid. Those deltoid muscles are also involved in other movements as well in the arm. So the posterior head that we're looking at there is involved in external rotation, so twisting or turning the arm, rotating it so that the hand is facing away from the midline of the body. The anterior head is involved in internal rotation, so there's more than just the flexion, extension and abduction functions of those muscles, but they are the main functions that you guys are going to need to be aware of. So that is the deltoid muscle group, 3 heads: anterior, medial and posterior head of the deltoids there. The next muscle we want to look at is your pectoralis major, your pecs. This is a large muscle on the anterior surface of your chest. If we isolate out that muscle to see where it starts and where it ends, we see there that again a large muscle. The origin is going to be towards the middle of the body. That is the origin here, and the insertion is going to be away from the body, so that's going to be on the arm. Crosses over the shoulder joint, so movement or contraction of the pectoralis major is going to result in movement of the upper arm. It's a big muscle, and like the deltoid, it attaches or originates at a couple of different points. So it has origin on the clavicle, on your collarbone here, and it originates on your sternum, on your breastbone here. And also what's not illustrated here is there is a sheath of connective tissue on your abdomen, and your pecs also originate from that sheath of connective tissue. So there we see it in white there. Okay, we'll cover that. We'll talk about that in more detail in another tutorial down a little bit later on. So there's your pec highlighted in yellow. We see that it originates. I might actually just strip a layer. Oh, takes the pec with it. It originates on the clavicle, the sternum, and onto this sheath of connective tissue here, and it inserts onto the humerus. Okay, so it inserts in a similar place but not the same place as the deltoid muscles. The deltoid muscles are in a slightly different position there. The pectoralis major is involved in lots of different movements of the upper arm. It's involved in adduction, so that's bringing the arm back down towards the midline of the body. Horizontal flexion, so that's bringing the arm across like that. And internal rotation of the upper arm. An example of that, of an exercise that targets the pecs, is going to be the bench press is a good example. If you think of a bench press when you're lying down, you're bringing your arm, your humerus goes from a horizontally extended position to a horizontally flexed position as you press the weight up. So that is horizontal flexion, one of the main jobs of the pectoralis major muscle there. Lots of other exercises to target it though as well. The next muscle that I want to look at is called the pectoralis minor. So the pectoralis minor is located deep to the pectoralis major. If I strip that layer back off, here we have the pectoralis minor. Now, the pectoralis minor is an interesting little muscle, if we isolate it out and look at where it is, we see that it originates on 3 of the ribs here. So ribs number 3 to 5 is where that muscle originates. It runs up superior and posterior, so runs up and backwards, and it inserts onto the scapula here, onto your shoulder blade, not onto your arm. So one of the main jobs of your pectoralis minor is protraction of the scapula, pulling your shoulder blades forward, and it anchors the scapula to the rib cage. So it's a very, very important muscle for stabilizing the shoulder joint. So there's you've got, if I go back there, your pectoralis minor stabilizes the shoulder joint here, and we've got loads of other muscles that we'll talk about later that anchor and stabilize the scapula, the shoulder, at the back here. So these muscles are all working together to ensure stability of the shoulder joint. So the pectoralis minor is not specifically involved in a movement like the bench press because it doesn't insert onto the arm. It's not involved in movement at the arm. It is involved in stabilization of the scapula, or protraction of the scapula as you pull that pull your shoulder blades forward. The next muscle I want to talk about is your serratus anterior. Your serratus anterior is the muscle highlighted in yellow there. So let's isolate it out, and again we see that this is another muscle that originates on your ribs. This time it originates on ribs 1 through 10. So we can see there on each of the ribs we've got a little bit of tendon that is attaching that muscle onto the bony structure there, and that muscle, again, it runs posterior. It runs around the back of the rib cage there, and it actually attaches on to this onto the scapula on the medial border of the scapula. So if we're looking at the back here, this is the medial towards the midline of the body. It attaches onto the medial border of the scapula there. So your serratus anterior muscle is involved in protraction of the scapula, again like the pectoralis minor, and it anchors the scapula to the rib cage, again further stabilizing that shoulder joint. So sometimes when you see someone, again, if someone who's pretty lean, and it looks like you can see all of their ribs underneath their arm, what you can actually see is their serratus anterior, and where their serratus anterior attaches on to their rib cage. Okay, moving on, I want to look at the biceps. So the biceps are another muscle that's involved in movement of the shoulder joint. So what we have here, the biceps, as the name implies, bi, has 2 heads. The bicep has 2 heads on it. So if I no, not fade that, sorry, I want to fade the others. What we see there is we've got this muscle that lies on the anterior surface of the upper arm. It splits into 2, and it originates up on your scapula. We'll look at that in a little bit more detail. Then there's the belly of the muscle lying on the top of your arm. It crosses the elbow joint and it inserts onto your forearm below the elbow. So now if I just one section of that and isolate it, what we see there is we get a little bit more information there. We can see the 2 different heads. What I want to do, I think, is it's not showing me with the bones, but what I can assure you is that it attaches onto the scapula. So if we go up and look in here, what we see is that 2 different heads of the bicep attaching onto your scapula, which is lit up there. So we see the bone in green, and we see the bicep muscles in yellow, and we see that it attaches onto your scapula. So it originates up on your shoulder blades, crosses over, oh, how did I do that? Crosses over the shoulder joint. The belly of the muscle runs down your upper arm, and then it inserts onto your forearm below the elbow joint. I'm going to exit my multiple selection there, and zoom back out. So your bicep, because it crosses over two joints, it crosses the shoulder joint and it crosses the elbow joint, it's involved in movement at both of those joints. Now the main function of the bicep is to flex the elbow. So if you want to decrease the angle of the joint at the elbow, you are going to flex your bicep muscle. As we flex the bicep, the insertion of the muscle is pulled up towards the origin and it results in elbow flexion. Because the bicep also crosses over the shoulder joint there, it's an assist. It assists in some movements like flexion of the shoulder as well. One of the last muscles I want to show you today is another elbow flexor called the brachialis. Okay, the brachialis lies deep to the bicep muscle there. So even though I have it highlighted, we can barely see it there. If I strip the bicep back out, oh, why is it doing that? Okay, I'll just isolate that. What we have is this brachialis muscle here, which originates on your humerus. So it begins, we can see it there attaching onto the humerus. It crosses the elbow joint and it inserts onto your ulna there below the elbow joint. And the brachialis is a very, very important forearm flexor. And an example, it obviously involved in anything that where the elbow has been flexed, like a bicep curl, but an example of an exercise to target that muscle specifically would be a hammer curl, where you hold the dumbbell fixed in position. Would place a little bit more emphasis on the brachialis while still training the biceps as well. So I think that's all I wanted to cover today. So we've covered a lot there. We've introduced the muscles, we've talked about the origin and the insertion of the muscles, we've talked about tendons and ligaments. And then we have started to look at the muscles of the body, focusing on the shoulder girdle initially. So we've looked at the deltoids, we've looked at the pectoralis major, the pectoralis minor, we've looked at the serratus anterior, we've looked at the biceps and the brachialis. Next week we'll spin around and look at some of the muscles on the back here. So we'll look at the triceps and we'll start to look at the muscles here in the upper back that also involve that also result in movement at or around the shoulder girdle. Okay, that's it for today. Thank you very much for your time.